In 1988, we knew the incidence or the amount of autism that we saw in the population affected 1 in 1,000 children. Health Canada just released its latest numbers and it's 1 in 50. So 1 in 50 children have a diagnosis of autism spectrum disorder.
Avery's 4 right now. He's a bundle of joy all the time usually. He's always walking around with a smile on his face and laughing, so can't be much better. Avery would display some characteristics that we found odd at first, or troubling maybe even around other kids not knowing how to interplay with them or interact. You could see some signs of delay, maybe just missing some milestones and stuff, nothing really severe. And then as time passes on, you just come to the realization as a parent that if you don't do something and there is something wrong, then you're just going to be even farther behind the 8 ball.
When you meet a family that's waiting for a diagnosis, they're psychologically frozen. They're not sure what the next steps are. They are unsure why their child is displaying the sort of challenges and behaviors that they have. And a diagnosis helps families move forward.
Some of our families have unfortunately been waiting a long time to have an assessment. And that not knowing, right? Not knowing whether or not that's what this is or what else might be going on and how to support their children is really challenging for them. So being able to be heard, to have the question addressed, someone to talk through those next steps and what might be available to them is a critical need for these families.
We see children all the way from Red Deer to the Arctic Circle. It's a lot that families have to do in order to get themselves to an appointment. And if we were able to find a way to meet them in their homes, it would save time, money, cost to the environment, etc. And so there birthed the idea of needing to be able to do that assessment with the child in their home environments instead of bringing them into a unique, a foreign, a distant, and uncomfortable environment.
I'd like you to set out the favorite toys you've selected for Ella to play with.
The APPLES, or the Autism Assessment for Preschoolers with Language Element Sequence, is a parent-directed and clinician-guided assessment that's done in the home environment where parents are able to lead their children in play activities that occur in day-to-day environments, directed through the internet with us on the other line, giving them directions on what to do.
Can you just show us, just provide her with some toys and let's see what she does with that?
We can essentially guide the families through different ways to interact and engage with their children so that we could elicit different types of play behaviors, requests, comments, or conversational opportunities to look at that social communication piece, as well as to observe any restricted or repetitive behaviors.
There was tons of doubts about the virtual part. Even though it was scary taking him into formal settings and knowing how he would usually react, you would assume something of that severity you would need to get in the same room with the doctor. So it was a little nerve-wracking at first. I would say after 5 minutes on that Zoom call, they calmed us right down. They said, "You're doing great." So very calm, very professional, but not too formal to make it awkward. It really was just as simple as it gets. I was so surprised, actually.
So it look, Mommy.
One thing that I expected, but I was actually surprised by, was how valid I felt the view I got of the child was. Seeing them in their home environment, where they're the most comfortable, wearing their pajamas when they woke up in the morning, having breakfast at the table, even some of those things that just happened naturally, I felt a very valid look at the child's overall social abilities, communication, and how the parents interacted with their children in that environment.
The experience went really well for Avery, I think. Obviously much more comfortable in his own home. That was one of the things that we noticed early on is formal sit-downs, doctor visits, hearing tests, etc. he really struggled with. So when we learned that this was an option, it was something we really thought would be better for him, and it worked out perfectly.
This tool has already been translated into French, into Spanish. Tagalog and Cree are underway. We're having psychologists use it in our preschool environments. It is just making healthcare access much more equitable and much more available all around the world.
Neurodevelopmental services for families are sparse and the network is fragmented. Virtual care cuts through some of those boundaries, so it's a real game changer.
It's comforting to know that there's so much help available to parents going through this when you don't really know that until you get to a spot like this where somebody tells you. Knowing that there's these avenues with these professionals, it's so relieving.
We don't talk about autism spectrum disorder in terms of severity. We talk about autism and how much support is needed in order to be successful in whatever environment that might look like. And successful might be in play, or in a little league game, or on a team, or just sitting in a circle participating with friends. And how do we provide those supports in order to make that success happen? That's what diagnosis is about. That's what intervention is about. That's what support is about. And that's what families are looking for, because they want what's best for their children.